covered by a layer of protective pigment called the macula lutea. In 1985, scientists identified this yellow pigment as lutein and zeaxanthin, two retinal carotenoids found in green leaf vegetables. If we raise the pigment above the retina, we can better understand how the yellow pigment filters out the higher energy blue light. This layer may be thinner in those with macular degeneration, thus providing less protection to the macula, and possibly adding to more degeneration. Additionally, it may cause light sensitivity. On the left side, we have the normal density of protective pigments. The right retina shows advanced dry macular degeneration. The thinner, less dense layer of protective pigments allows higher energy blue light to reach the retina. The right eye also shows a loss of the protective pigment of the retinal pigment epithelium, or RPE. Notice how light the macular area appears. Normally, as in the left retina, the RPE absorbs most of the stray light after it passes through the retina. When the RPE layer is damaged, light is reflected back through the retina. In advanced wet macular degeneration, large disciform scars may occur. These large white scars reflect light like a mirror. The light bounces around in the eye until it's fully absorbed. This results in an overexposure of the retinal image and causes light sensitivity and may decrease contrast. In very bright sunlight, either a gray or amber filter can be effective. However, as we demonstrated earlier, most macular degeneration patients have poor glare recovery. When they move from bright light to dimmer light, their vision may dim. When you walk onto a porch, the gray filter may suddenly become too dark for a macular degeneration patient, while the amber still provides a safe view down the porch. Remember, if you turn from a bright street onto a shade-covered road, suddenly the gray may be too dark and endanger your...
If a baby was bothered by light, seemed to be upset with light and a little photophobia, what were your concerns about?
Well, if it's a baby, first of all, it's very hard to distinguish what is bothering the child. He's not going to tell you, my eyes bother me, the light bothers me. But if the child is able to communicate with you and tell you that my eyes hurt, the light bothers me, one condition that it could be is congenital glaucoma. Glaucoma does occur in infants and young children, and it will typically cause a photophobia or a light sensitivity. The majority of kids who have light sensitivity are not glaucoma patients, though. They usually have an aversion. Some light-skinned children can have an aversion to light simply because they're light-skinned and they have probably more glare. Their irises might be blue, more light can get in. Some children who are perfectly normal have an aversion to light, and it might not be anything like glaucoma. So, as a parent, you have to distinguish what's important and what's not. If a child has glaucoma and light sensitivity, usually you'll notice that he's tearing a lot. You'll notice that his eyes are getting a little red. Possibly the corneas are getting a little steamy appearing. They look kind of clouded a little bit, and his eyes could appear very large. So if you have a child who fits that description, you might have a child with glaucoma. Most people who have an aversion don't have all those problems. You could also have a light sensitivity that comes on suddenly because you have a foreign body in your eye. Okay? Even very, very minor things can cause a child to have light sensitivity. Conjunctivitis. An iritis, which is an inflammation inside the eye, can cause a light sensitivity because the actual cilia, which is part of the iris, it goes into spasm because of white blood cells when the light hits it. Those children will also have a light sensitivity. Only a qualified ophthalmologist or pediatric ophthalmologist can determine what the cause of your child's light sensitivity is. And if your child persists to have these problems, he should obviously see somebody who can determine what the cause is.
If a child had a high fever and photophobia, sometimes it's a very serious infection?
Yeah, it could be. I mean, there are problems such as, one I could tell you about is iritis is caused by a lot of different problems.